Why UVA? I guess the better question really is, why not UVA? Early on, even from afar, I could tell that the School of Medicine is committed to really ensuring that its students had a very good, very rich academic experience. It's easy to say that I would not be here without scholarship support, but I don't think it gives true weight to the gravity of what scholarship support has done for me. I've been able to not just dream big, but actually bring it to fruition.
You do the tallest ones.
Okay, you want blue?
My name is Brian Bellier. I'm a pediatric oncologist at UVA. I care for children who have been diagnosed with cancer. The Battle Building is a special facility to take care of kids with cancer for many reasons. I think it's not nearly as intimidating to the patients because it is so warm and friendly. At the same time, I think the families, the parents really feel confident. They can tell immediately this is a first-class facility. And we have plenty of space, we have beautiful rooms. We have a transfusion center where patients can go for chemotherapy, and then they get to go home that night and sleep in their own beds and be with their own family. And so it really stood out to me how much better their quality of life is having the Battle Building.
When a child likes to come to their oncology appointments, they're doing something right. People travel many miles to come here to get the care that we received right here in our own backyard.
My story with the center really began in 2009. My wife Marty was then diagnosed with stage 3C ovarian cancer. And the first question you ask is, what do we do and where do we go? And we were blessed that the University Cancer Center was here in our community. You get two things. You get world-class clinical services. And then the other thing is you get compassion and empathy. And the combination of those two really provided us with exactly what we needed.
One of the amazing things about coming into the Emily Kirk is we really can be more patient-centric, meaning that the patient comes here and if they need a CAT scan, they can get their CAT scan. Then they come directly up to see me. Then they go down the hall and get their chemotherapy. It's all about trying to make it as easy as possible. And again, having this building and this footprint available to be able to expand our services has been huge for our patients.
I'm getting often asked, what does philanthropy do in the field of transplantation? And the short answer is, it does a lot. It enables us to provide care in a way that otherwise wouldn't be possible. I mean, today we can look back and say that we have helped thousands of patients and that we have an environment that allows us to take care of the sickest patients who otherwise would have absolutely no hope.
One of the things that I have found fabulous about being at the University of Virginia these past 5 years is the amount of support the school has received from the deep relationships with donors. It goes beyond being able to have scholarships to enable us to have high quality and standards, but it's impacted and affected people's lives that we won't even know about, in the sense of our nurses going out and being not just the most prepared and the most compassionate nurses they can possibly be, but it opens up their eyes to the lives of many that go beyond their experience here in Charlottesville. They are not only able to be excellent nurses, but they will be nurses for a lifetime.
Medical research is expensive, and philanthropy provides the catalyst that most researchers need, where they can develop their technologies more quickly and move more rapidly to a place where they can help patients. It really is a lifeline for all researchers.
I can't stress enough how important the gifts that we receive are to our mission. We simply could not do this without that support. So I just want to say a huge thank you to everyone who has supported us in the past, who's considering supporting us now or considering supporting us in the future. It makes a world of difference.
You just couldn't do anything more important. And I will be forever grateful for having the University Cancer Center right here in my own community. Thank you.
Your support has really made an impact in my life and in the lives of students like me. And one day, I hope to be, I will be a good doctor, and I think that it's important to realize that your impact is not just on my life, but on the lives of all the people that I interact with and I touch and I do good things for. So thank you very much.
I would like to say thank you to all the people who helped make the Battle Building possible. You've done something that the doctors and nurses couldn't do to improve the quality of life of our patients. Thank you.
Thank you so much. You truly are making a difference in children's lives, just like Anna.
I want to give a big heartfelt thank you. We appreciate all that you have done to help move science forward and consider you part of the team.
I've benefited from philanthropy all my academic career, and I couldn't have done half of what we did without it, and I'm very, very grateful for all this. I'm also grateful to be here at the University of Virginia. So since I do research on diabetes, I'm going to thank you from the bottom of my pancreas for everything you are doing.
From the bottom of my heart, thank you so much.
As UVA's new president, I'm excited by all the important work that goes on across the health system, the outstanding patient care, the groundbreaking discoveries to improve human health, and the innovations for educating future generations of healthcare professionals. The success of our programs and the outstanding quality of our facilities, students, and faculty are built upon the contributions of donors like you. So thank you for your faith in our healthcare missions and for your generous support.
Thank you for all that you do. We couldn't do it without you.
Thank you so much for your very generous spirit.
It's because of you that we're the #1 hospital in Virginia. Thank you.
You care for us so that we can be there to care for others. Thank you from the bottom of our hearts.
Thank you.